Hello, my name is Mateja Zidarič and I'm a medical doctor in University Medical Center Maribor, Slovenia, in Department of Dermatology. Today I will present to you a clinical case report of a post-surgical Pyoderma gangrenosum. Pyoderma gangrenosum is a neutrophilic dermatosis defined by a pathological abundance of neutrophils in the absence of infection. It is a rare non-inflammatory disease of unknown origin that seems to originate from dysfunction of neutrophils, inflammatory cytokines, and genetic mutations. There are several subtypes of Pyoderma gangrenosum: classical type, bullous type, vegetative type, pustular type, and superficial granulomatous variation. The most common classical Pyoderma gangrenosum presents of extreme painful erythematous lesions that rapidly progress to blisters, which can progress to painful ulceration with undermined valiaceous border and purulent cover. The lower legs are most frequently affected, although it can present at any body sites. The condition predominantly affects adults. In some rare cases, the children can also be affected. Post-surgical Pyoderma gangrenosum is rare, but can occur in all kinds of surgeries, for example, plastic and reconstructive surgery, cardiothoracic surgery, orthopedic surgery, etc. It macroscopically mimics an infection of the operative site. It often results in unfavorable surgical revisions. It is often the diagnosis of exclusion, requiring the investigation of infection and other causes of cutaneous ulcer before diagnosis. In our case report, we will present an 18-year-old female patient with history of post-operative complications, sepsis, and multi-organ failure after patellofemoral ligament reconstruction. 3 years after surgery, the 16 cm wide wound remained on her right leg, therefore she was scheduled for post-reconstructive surgery with skin graft. Before operation, she received prophylactic antibiotics. The surgery went well. On 6th post-operative day, she became hypotensive and tachycardic. She developed septic shock and was admitted in the intensive care unit. On right thigh was 20 × 27 cm wide ulcer covering skin and subcutaneous tissue, with mildly expressed livid margins and epidermolysis. Extensive secretion and extreme pain upon palpation was present. Treatment firstly began with different types of antibiotics due to septic shock and unimproved clinical picture with high laboratory levels of C-reactive protein, high procalcitonin, and leukocytosis. Blood cultures and swab cultures showed no bacteria present, therefore we raised the suspicion of neutrophilic dysfunction. Pyoderma gangrenosum is defined by the pathohistological presence of neutrophils in the absence of infection. The cause and mechanism are still not well known, but there is a correlation between 3 factors: neutrophilic dysfunction, which results in triggered inflammation by T cells and inflammatory mediators, and a responding genetic background. Histopathological results in our case showed suppurative dermatitis, vesicles filled with neutrophilic granulocytes in epidermis, and epidermolysis. We also did a direct immunofluorescence test, grain stain test, and periodic acid sheath stain, which were all negative. so that made our diagnosis accurate. After our diagnosis was accurate, we started immediately with intravenous corticosteroids. Locally, we administered topical corticosteroids and polyurethane films for wound dressing. The response to treatment was successful. She became stable and the wound started to heal properly. The other possible treatment therapy includes high dosage of human immunoglobulins, immunosuppression agents, and TNF-alpha inhibitors. So here you can see the treatment course in our patient and how the wound started to heal properly. So, as well known, Pyoderma gangrenosum is a challenging skin condition that requires a multidisciplinary approach. Post-surgical Pyoderma gangrenosum is a rare pathology that develops usually in the first 10 days after the surgery. It is important to remember that the surgery is controversial because it is a source of pathogen. Only when Pyoderma gangrenosum is in control, surgical removal of necrotic tissue under immunosuppression therapy can be beneficial to prevent secondary skin infections and for subsequent skin graft. In some clinical cases, the negative pressure therapy also had satisfying results for preparing the lesion for the skin graft. There has been made many correlations in literature between Pyoderma gangrenosum and systemic inflammatory diseases, for which neutrophilic dysfunction is a key element. Recently, our patient developed Behçet disease. Though the relationship between Pyoderma gangrenosum and Behçet disease is not referred in diagnostic criteria of Behçet disease, we stress the importance of keeping it in mind in further cases. Thank you very much for listening and have a nice day.